Hi guys, my name is Dr. Iqbal and I'm a board certified internal medicine physician who also studies on integrative medicine. My podcast today is about depression and how natural medications compare to pharmaceutical drugs when it comes to fighting off depression. This is a very important topic as 1 in 10 Americans suffer from depression, and that number continues to rise as we see a lot of changes that are going on in not just in our political environment, but also throughout the world as we are seeing more stress, more depression rising because of rising inflation. So I thought this was a fair topic to bring up. I currently work for Duke University and have worked with University of North Carolina. However, for the benefit of my podcast, they are not related to either of those universities, and my work and my research stand alone. I do want to remind you before considering any of the natural treatments that are mentioned in this medical podcast, it is important that you discuss them with your physician. Anything that you consider should be taken under their clinical supervision. That said, our topic are going to include both natural supplements such as vitamins and fatty acids, as well as natural botanicals that are available over the market, which ones the studies have shown to be more beneficial than the others. So let's get started on this topic. First up, we're going to talk about is omega-3 fatty acids. Now, data does suggest that folks that have low levels of omega-3 fatty acids do tend to have a direct correlation with increased depression. Omega-3 fatty acid and imbalance with omega-6 has also shown a direct correlation when it comes to depression. Omega-3 is quite important fatty acid as our nerves require these essential fatty acids to build their ends or the synapses where the neurotransmitter function is regulated. And depression is an imbalance in these neurotransmitters. So it plays a very vital role when it comes to maintaining and balancing our neurotransmitters. Usually, studies are showing that addition of EPA and DHA combined with omega-3 fatty acids is of more benefit than using omega-3s alone. Folks can incorporate omega-3, whether it's through vegetarian supplements like flax seed oil or through fish-based supplements, or they can also substitute with taking fresh fish 2 to 3 times a week. Moving on next is our next supplement, which is vitamin D. Now, larger Dutch studies have showed that people who are 65 and older have lower levels of vitamin D and hence ended up having higher rates or severity of depression. Now, supplementing is an inexpensive way to help with depression, and it also has benefits in the elderly, such as preventing frequent falls, heart disease, and some cases, colon cancer as well. So, an important vitamin to consider, particularly if you are older than the age of 65 or your diet is deficient in vitamin D. Other vitamins that are important are vitamin B and folic acid. Folic acid and B12 have been shown that they're important in the making of neurotransmitters in our brain. No large-scale studies are yet available for their role in depression, but it can be considered in people who are not eating enough vitamins in their daily life, such as the elderly, which may be more prone to depression and deficiencies. So B6 is also very important in making of serotonin, and its levels have been found to be lower in folks that are depressed, especially premenopausal women that are taking oral contraceptives. They may be deficient in this vitamin as well. Other studies have showed that folic acid is also an important neurotransmitter maker and is identified to be on the lower side in depressed people. And it has been shown that those with low folic acid levels also don't respond very well when they are taking pharmaceutical antidepressants as well. So again, it's important to consider the role of folic acid as well in your diet. You have to go to my website at www.fatimaiqbalmd.com to read all the dosage recommendations and side effects, as well as additional treatments that are present. I do recommend that you always ask your doctor or your physician before starting any supplementation. However, the science and the data still stands. Let's move on to the next supplement, and that is known as SAMe. S-A-M-E. This is called S-adenosine methionine. It is an important, very important again, in the metabolism of those neurotransmitters that are involved in depression, like norepinephrine, serotonin, and dopamine. It is not formed well when it is found in depressive folks. It is not formed well, and its supplementation has shown that it does improve the brain's neurotransmitter function. However, these studies are small in comparison, and large-scale studies are lacking in showing any benefit. So smaller studies show some benefit, but larger studies not so much. In the smaller studies that did end up showing the benefit, it showed that when they were compared with antidepressants, they were found to have similar benefits to a pharmaceutical antidepressants. Another study actually combined the antidepressant SSRIs such as Prozac, Paxil with the SAM and found that it gave better results. Now, this may be helpful in folks that are not responding to our typical pharmaceutical antidepressants, so something to consider. The enzyme SAM is well tolerated and has lesser side effects than our typical antidepressant drugs. And it also has a faster onset of action. So sometimes it can be used when patients are starting off on an antidepressant and just starting off at lower doses of SAM at the same time, eventually tapering off as your antidepressant starts working or starts doing its function. Another enzyme to consider is 5-HTP or hydroxytryptophan. Now, this guy converts tryptophan to serotonin. And the evidence, however, that points towards the benefit of this in depression is poor. There's only 2 studies that are mentioned of somewhat good quality that point towards its benefit. However, at some point, it was taken off the market because of potential contamination effects of it. Now it's back on the market as the FDA considers this that the problem with the at that time was because of contamination issues. But folks still use it for depression. At some point, it was regulated for depression to be used in depression and sleep disturbances. So another antidepressant consideration when it comes to natural supplements that are available over the market. However, keep in mind that the studies on this is not very extensive. There's only 2 studies, and they were done with good quality and did show some benefit to it. I would mention this though, not to take this with your antidepressant unless you are being supervised by a physician. Now, again, I can't stress this enough to go to my website at fatimaiqbalmd.com and read the full article with the side effects, dosage recommendations that have been clinically studied to understand much better, along with that, other treatments as well. Now, we're going to move on to the next part of our natural supplementation, which are the botanicals. The most and the biggest one that we also, a lot of medical students and residents would hear about it as well, is St. John's Wort. Now, this is again a licensed product for the treatment of mild to moderate depression in Germany since 1984. So if the Germans think it is good to use, this drug has benefits on serotonin, dopamine, and norepinephrine, which are, again, those neurotransmitters that are regulated in depression or they are imbalanced in depression. So this drug has shown benefit in that. 2 large United States studies have found that St. John's Wort unfortunately was not as effective in treatment of severe major depression. So mild to moderate depression, 29 studies found that it was effective as antidepressant in mild to moderate depression. Along with that, it has 10 times lesser side effects than your pharmaceutical antidepressants. There are a lot of side effects that are associated with it that you should read about before you even consider this natural supplement. Along with that, it is metabolized through the liver. So if you are taking other pharmaceutical drugs, then it may interact with it. So always ask your physician before starting this medication. Now, there are many supplements out there for St. John's wort. You will see them on Amazon, you see them in your grocery stores, but not all of them are clinically studied. Particular standard products that were studies had a minimum of 2 to 5% hyperforin or 0.3% hypericin, which is part of that St. John's wort formulation. And those were the ones that were clinically studied in the clinical trials. And it was found that, on my research at least, there were only a few products on the market that have been through these clinical trials. And one of them I have listed in the description box below. It is called Perika by Nature's Way. By the way, I am not endorsed by them. This is part of my research that I found that this one had at least 3% hyperforin in it and maybe more, clinically beneficial when it comes to treatment of mild to moderate depression. It does take time for St. John's wort, just like any antidepressant, to take its effect, and sometimes it may take up to 2 months to take full effect. So keep that in mind as well. Next up is saffron. So for all the Middle Eastern folks out there, this is a very traditional herb that is used in both Islamic and Middle Eastern medications. Not much studies, again, on saffron, by the way. There was a small Iranian study that studied about 500 people, and it found that it was better than no treatment for mild or moderate depression and had similar effects to antidepressants. So again, very small study. And the last one I want to talk about is Rhodiola Rosea. Again, no mechanism of action of this herb is known. However, a small study showed that addition of rhodiola to your antidepressant therapy led to improvement than the pharmaceutical drug alone. So these are some of those herbal supplements that are out in the market, and I see a lot of them in my pharmaceutical aisles. They are mentioning promising depression relief. So I thought this was a good topic to bring up to our audience to understand what they are about and which ones have been clinically studied to show benefit and which ones have not so much. I want to stress again, always ask your physician, talk to your doctor, particularly ones that are studying on integrative medicine and understand the science behind natural products as well, to give yourself a good idea whether this will suit you or not. Go to my website at fatimaiqbalmd.com, where I also talk about use of caffeine, alcohol, exercise, mind body stress relief therapies, how these are showing promising effect as well on depression. So you can read the full article on there. I also have lists of all the products that I've mentioned in the description below. And as always, guys, make sure you subscribe and hit the bell icon as I continue to bring you new articles about different disease process and how natural supplements that are out there are comparing with pharmaceutical drugs when it comes to treatment. That said, I hope you enjoyed this podcast, and I will continue to put out good content for you. Thank you very much.